Hi, this is Dr. Mamta Dighe, Director of Xenith Advanced Fertility Center in Pune. Today we are going to speak about something that we all want to know. How should we choose an IVF clinic? There are so many couples undergoing infertility and IVF treatment today that it is extremely important to understand how to choose the right center to go to. Which are the factors which make up a good clinic? That is something that we are going to touch upon today. I think one of the most important things that a couple seeking treatment should look for is the lead doctor certified and gotten a degree in practicing infertility. Basically, just IVF is not what a couple is looking at. What you really need is at a person who is trained in reproductive medicine. Now, how is reproductive medicine different from just an IVF or an infertility specialist? A reproductive medicine specialist has been trained in all aspects of infertility, right from the endocrinology to the male factor, which is andrology, to the lab factor, which is embryology, to all the other factors like the surgical factors which come in, where we adopt a few small treatments or surgical treatments in infertility like endoscopy. A reproductive medicine training helps the practitioner encompass all the factors which can therefore help them give an optimal result to the patient. We all know that every couple does not need IVF, and it is this that a specialist can offer you, is that how many patients can conceive with them even without undergoing an IVF treatment. I always believe that instead of just looking at IVF success rates, we should try and map the number of patients who visit a center and go out pregnant from that place even without doing an IVF treatment. And this is what a reproductive medicine specialist is trained at, to pick up the subtle causes of infertility, the subtle problems, and to understand the nuances of treatment which can give you much more effective results in any kind of treatment of infertility. The next thing that we need to look at is, what is the team like? We all know that IVF is not just a single person led treatment. It is not only important to look at the doctor, but it is also important to look at the team and the infrastructure that the clinic has to offer. Therefore, a good IVF center should have a team of a trained reproductive medicine specialist, a gynecologist, an andrologist, an embryology head, a lab technician, and a person skilled at doing very good endoscopy or laparoscopy and hysteroscopy work. If you have a team which is focusing on all these aspects of infertility individually, they can concentrate on all these small factors and together make sure that the patient can conceive not only with IVF but by various other forms of treatment, which could even be as minimal as just detecting the problem and resolving it, or just a simple intrauterine insemination. The third factor is to try and see whether this center is a registered center. We have national bodies today like the ICMR or the ISAR, which is the Indian Society of Assisted Reproduction, and there are places where an IVF center has to register and state that they are working as an IVF center, and there are certain norms that they have to follow in order to get recognized. And therefore, a center which has applied for registration and has informed the governing body that they are practicing IVF and this is an IVF center is definitely somebody that is following all the norms and requirements to practice infertility and IVF. I also think that a center which can provide treatment which are required in infertility, like for example at Xenith Advanced Fertility Center, we have a nutritionist in place, we have counselors, very renowned, very good counselors, so that whatever aspects of stress or infertility or dietary factors are affecting the patient can be resolved within the same premises itself. And it's very important in order to give an effective result, to have all the required treatments and requirements of infertility under the same roof. And therefore, a clinic which encompasses all this is a very important aspect of what a patient should look for when they are looking for an IVF clinic. Another important thing that we all know is that how is the laboratory? Is it a modular laboratory? Do they have good air handling units? Do they have good quality care and quality management systems in place? How is the lead embryologist is extremely important. A very, very important factor is, does the center have full-time embryologists? So there are many centers which have visiting embryologists, and where batch IVFs are done, wherein you are getting embryologists from outside who come in for a short period of time. But it is important that the care of the laboratory is ongoing and is taken care of completely. And therefore, it is also important to note whether a center has a full-time embryologist who can take care of the laboratory. Of course, we all know that transparency is also very important in the whole process, and helping the patient and making them comfortable is another important aspect. I think if we look at all these factors and assess the team, assess the lead doctor, assess the embryologist, assess the ethos and the way of working of the center, and then make our decisions regarding which center to approach, that is the correct way to go. Because we all know that IVF is not something that can always guarantee a successful outcome. So it is not just the outcome that you should look at, but you should also look at how the complete process is addressed. Thank you so much for listening to this, and please do leave your comments. We would welcome that. Thank you.